Skin diseases of cattle. These include alopecia, photodermatitis, allergic dermatitis, viral dermatitis, bacterial dermatitis, fungal dermatitis, parasitic dermatitis, and neoplastic dermatitis. For alopecian cattle, they can get hypertrichosis genita generalisata. This is common in Holstein Friesians. And hypertrichosis genita areata is found in Herefords. These are from B2 and zinc deficiencies, and the symptoms are cachexia and severe chronic disease. Sheep, they can get chronic weight loss and cachexia and pseudotuberculosis. From a protein or cobalt or selenium deficiency, you can get wool eating at the end of winter and scabies. For photodermatitis in cattle and sheep, the primary cause is St. John's wort, buckwheat, and lupinus albus. The secondary cause can be congenital porphyria, as well as liver damage from lupinus species, or glucocorticoids. The signs are lesions on hypopigmented areas after sunshine exposure. These include the head, extremities, and udders. We can see edema, weeping, and gangrene. For the treatment, make sure they have no sunshine exposure and eliminate the cause. Laxatives and topical treatment can also help, and antihistamines and antibiotics for a secondary infection. For allergic dermatitis, they can get leg dermatitis. This can be from potato poisoning and dirty straw, and the signs are exanthema and vesicles, and this can lead to pus and necrosis. And for the treatment, change the feed. You can give local treatment and give antihistamines and give dry, clean straw. They can also get post-vaccine dermatitis, especially from the foot and mouth disease vaccine, just in endemic regions. The signs are papules, serum, and scabs on the neck, and the extremities on the udder. There's also fleece rot in sheep. This is from a constant wet fleece. And there's just generally urticaria, which is an acute allergic dermatitis. It can be from vaccination, blood transfusion, drugs, allergens, bacteria, parasites, and milk allergies. For viral dermatitis, this can be caused by foot and mouth disease, which is an aftovirus. You can see vesicles and erosions and scales on the nose, hoof, and mouth. The diagnosis, it spreads like crazy and there's high fever, and swine can also get it. For malignant cattaraural fever, this is caused by herpes virus, Alcibian herpes virus 1 and ovine herpes virus 2. This comes from sheep, so you need to separate cattle and sheep. They will get lesions on the nose, udder, scrotum, and thigh. For bovine viral diarrhea, this is a pestivirus, which is a part of the Flavivirus genus. You can also get mucosal disease when they have the cytopathic strain and the non-cytopathic strain together. It can cause bleeding and ulcers on the hoof margin and the interdigital space. For papillomatosis, this is caused by the papillomavirus. Spread through contact, injuries, and blood-sucking arthropods. And for the treatment, you can do surgical removal or give an autovaccine. For vesicular stomatitis, this is spread by the vesiculovirus, which is a part of the Rhabdoviridae. See erosions on the teeth, foot, and lips. Lumpy skin disease is caused by the Capripox genus. Blue tongue is very common in sheep. It's spread by the Orbivirus, which is a part of the Rheoviridae. You can see a swollen tongue, skin edema, erosions, and ulcers. Sheeppox is also part of the Caprivirus genus, and we can see inflammation, edema, and black necrosis. There's also cowpox, pseudocowpox, and bovine papillostomatitis. They cause erosions and crusts on the teeth and the udder. And cowpox and pseudocowpox cause zoonosis. There's also ulcerative mammalitis, which is a herpes virus, and it happens on the teeth and udder. It causes ulcers, and there's also cyanosis. And ORF occurs in sheep and goats. It's spread by the ORF virus, which is part of the Parapox virus genus. And it causes ulcerations, crust on the distal limb and mouth. For bacterial dermatitis, Fusobacterium necrophorum, it causes skin lesions in calves and lambs. And in adults, it causes panorrhitium, which is infection of the nail. And Mycobacterium tuberculosis causes tuberculosis, which are nodular skin lesions. And Corynebacterium pyogenes causes purulent dermatitis. For abscesses, they can be caused by Turparella pyogenes, Corynebacterium pseudotuberculosis in small ruminants and camels, as well as Fusobacterium necrophorum and anaerobes and Staphylococcus. For diagnosis, you do ultrasound, and for treatment, you give antibiotics. For fungal dermatitis, this is caused by dermatophytosis, which causes zoonosis. This is caused by Trichophyton verrucosum. The factors are high humidity, overcrowding, and darkness, and bad hygiene, as well as vitamin and protein deficiency, and as well as ascarids and coccidia. The signs are it appears on the neck, head, and trunk. You can see oval lesions, crusts, alopecia, but there's no pruritus. The diagnosis, you can do a skin scraping. And the differential diagnosis is scabies or zinc deficiency or lice. For the treatment, give vaccination and vitamin E, or enolcolazole locally. Parasitic dermatitis, such as scabies or mange mites, Cattle and sheep can both get sarcoptic scabies, coreoptics, and the signs are skin folds, crusts, and pruritus. It's an indicator disease, usually from neglect, poor hygiene, or low immune status. And it can occur with trichophytosis. And the neoplastic dermatitises are melanoma, which is malignant, and eyelid transitional cell carcinoma. The treatment, you do enucleation, which is taking out the eye.